This is Selma Schimmel for the Group Room in Chicago at the annual AACR meeting. AACR is the American Association for Cancer Research. This is a really important meeting because this is where physicians and researchers gather together and talk about the latest trends and developments in cancer research. And joining us now is Dr. Gad Rennert, Director of the CHS National Cancer Control Center, head of the National Israeli Breast and Colorectal Cancer Detection Programs, Minister of Health and Israel Cancer Association, Chairman of the Department of Community Medicine and Epidemiology, Carmel Medical Center, and B. Rappaport Faculty of Medicine, Technion. Those are a lot of titles.
Yes, that's what happens when you work in a small country. You end up having a lot of hats.
Your talk that you're doing here at AACR, Can Cancer Prevention Be Individualized? What does that mean exactly when you speak about cancer prevention in this capacity of individualization?
Prevention is a tricky target to achieve. And our philosophy until now was that one size fits all. We said to the people, don't smoke, don't eat this, eat that, exercise. Okay, all our messages were population-based messages. Okay, they were to the population at large. Okay, now a lot of these messages have not been adopted by the people because it's hard to not do and to yes do and all, and constantly get messages of don't do, and don't do. Doesn't work well. And even in the US, where it probably excelled the most compared to other Western countries at least, still smoking rates are high and obesity rates are high and all of that. Okay, so the idea here is that maybe on one hand, not the same message needs to be given to everybody. So it's possible that some people will be damaged by obesity much more than others. And at the same time, maybe if we give an individual message to an individual person to say, you specifically have genes that show that if you will be obese, you'll suffer from it tremendously, okay? Maybe you'll be more inclined to adhere to the general message that usually doesn't really attract your attention. We go further than that. We are talking today about medicines that have ability to prevent cancer. And I'm not talking about the specialty medicines like tamoxifen or for the high-risk people. I'm talking about the suggestion that aspirin and statins can reduce risk of cancer of a lot of different cancers. So again, if I were to come to the people now and say, okay, start using aspirin daily, whatever from age 50, most people, if they're healthy, will not be too happy to go on a drug now for life to prevent cancer, okay? If I were able to say, okay, about 30 or 40% of the aspirin users have a gene fingerprint that says that they will benefit the most from aspirin, okay? On the other hand, there are 30% of the population who have the fingerprint of bleeding in response to aspirin, okay? And then I go to the people and I say, okay, you, the bleeders, don't go on aspirin. You, with a high chance of getting a benefit, you go on an aspirin. Mm-hmm. So we weigh the people based on their benefit to harm ratio. Exactly. And can send them a personal message to say, you're proper for that, you're not. You're proper for statins, you're not. And now we have a similar story evolving on bisphosphonates, about the same story. So if we could then get all these people, get their personal message, I think that the benefit level will increase and the adherence will increase.
Do you visualize that one day people will be able to go through a genetic screening and will be able then to physicians will be able to decide based on their results who's at risk for which cancer, and that a time will come that we'll be able to treat people to ultimately prevent that cancer, or that maybe there will be a mechanism to do some kind of genetic engineering to repair the genomic mishap to prevent the cancer from ever happening?
So with the first half, I'm very comfortable. Yes, definitely, we are putting our fingers more and more genes that if the doctor, now remember, there's a whole, we need to educate the doctors too on that. This is, we need to educate the population, the doctors, that's beyond science. So my belief is that yes, we'll be able to have fingerprints of personal, whatever constituents that will enable us to suggest maybe proper diets. One of the lectures today will be on diet. Proper behaviors. One of the lectures today in the session will be on addiction genes. Okay? The genes that if you started smoking will not let you quit. They will not cause you to start. So these people shouldn't try to refrain from smoking, because if they start, they will not be able to stop. There's a lot of interesting, unbelievable worlds of genetic influences.
Like alcohol would probably
Yeah,
fall in.
again, it's one of the addictive behaviors. So we're trying to look at all these genes and actually give the doctor a picture of risks and how to avoid them. One of the lectures will be on genes that, or actually expression of genes that will allow us to decide who should go to have a CT for early detection of lung cancer, given that this technology has high risks in addition to the benefits. You want to actually send only the people who are apt to benefit from it.
Exactly.
So if I could identify those high risk among the smokers, I could send those and not the others. So the genes can do a lot in the field of prevention, be it behavior, be it diet, be it preventive medications, be it screening activities, etc. The second part of whether we'll be able to correct things, well, for one, it's not my field of expertise. And honestly, everybody's talking about it, but we're yet to see the first evidence that it has been done repeatedly on a certain medical issue without risk or with low enough risk, etc. So I believe it'll come, but I have no way of predicting this horizon, when we're going to see it.
So I guess that means you're going to have to come back and talk to us again, because I found our discussion fascinating. And as more research evolves, you're going to have to come and teach us more.
Okay.
Thank
Great.
you,
You're welcome.
Professor Dr. Gad Rennert, who comes to us from Israel, is the director of the CHS National Cancer Control Center, the head of the National Israeli Breast and Colorectal Cancer Detection Programs, Ministry of Health and Israel Cancer Association, chairman of the Department of Community Medicine and Epidemiology, Carmel Medical Center, and B. Rappaport, Faculty of Medicine, Technion. Thank you so very much for spending time with us here at AACR.
Thank you too.